Of this week's module lectures, we will be discussing injuries to the head, face, eyes, ears, nose, and throat, as well as discussing several general medical conditions that are quite common among athletes. Just a warning, there are some slides in this presentation that are kind of graphic, so if you can't handle looking at those images, please just skip ahead and then just make sure that you're reading the chapters in the book on how to handle different situations. Extremely brief review of the anatomy of the head. We have the skull, which has several different fused bones that protect the brain underneath. Immediately inferior to the skull, that is where the meninges lie, and the meninges are the protective layers surrounding the brain and the spinal cord, which will become important when we talk about specific general medical conditions later in this lecture. The face is made by the zygomatic, the maxilla, and the mandible bones, and we have the teeth that lie within the maxilla and the mandible. The eyes lie in the orbital fossa of the skull. The areas that we are mainly concerned with in athletics include the optic nerve at the back of the eye, then we have the retina and the cornea. With the ear, we need to be concerned with the shape and appearance of the outer ear, as it's vulnerable to lacerations or hematomas while individuals participate in athletic activity. When it comes to general medical conditions, it's also important to remember the components of the middle and inner ear. The middle ear includes the eardrum and the three ossicle bones, the stapes, incus, and malleus. The inner ear contains the cochlea, semicircular ducts, and the vestibular nerve. The throat contains several areas that we need to be concerned with. The first is the esophagus and the trachea. The esophagus is what leads to the stomach, and the trachea is what leads to our lungs. Damage to either of these can result in severe issues for a patient. We also need to bring attention to the hyoid bone. This is important to know about because a blunt force to the throat can actually fracture this bone and lead to many different issues, some of them even severely life-threatening. There are several different types of skull fractures. Thankfully, we can prevent a fractured skull with the use of protective headgear. In the event of a skull fracture, after some sort of blunt trauma to the skull, the patient will experience severe pain and migraine-level headaches. There may be blood in the middle ear and/or ear canal, or even bleeding through the nose. There may also be discoloration around the eyes called a raccoon sign, or there may be discoloration behind the ear known as battle sign. If an athlete in our care experiences a skull fracture, it is not necessarily the skull fracture itself that causes the most serious problems, but from complications that stem from the intracranial bleeding. More serious issues may also arise from bone fragments that impact the brain and the possibility of infection. In the case of a skull fracture, immediately immobilize the patient and then have them be transported to the emergency department as soon as possible. Mandible fractures or mandible injuries occur most often in collision sports when the lower jaw is subjected to a direct blow. The main indications of a fractured mandible are deformity, loss of normal closing of the mouth, pain with biting down, bleeding in the gums and around the teeth, and possibly numbness or loss of sensation of that lower lip. A mandible fracture requires temporary immobilization with an ACE wrap. The wrap should circle the jaw to immobilize it in place without pressing into the throat. The athlete should then be referred to x-rays and follow-up care. The cheekbones are also prone to injury in combat and collision sports and are injured by direct blow to the zygomatic bones. There's usually a deformity that occurs in the cheek, but if not, a bony irregularity can be felt with palpation. There's usually also a nosebleed associated with this injury. The patient will often have pain and visual abnormalities like seeing double or being unable to focus their sight on objects near or far away. They may also experience numbness in their cheek upon palpation. A black eye will develop, and there is usually pretty intense swelling that occurs with this injury. These individuals should be kept in an upright position as they're transported to the hospital for x-rays and for follow-up care by a physician. Facial lacerations come in all shapes and sizes and can happen anywhere on the face and on the scalp. They are usually the result of a blunt force trauma, but can also occur from sports equipment that creates a laceration in the skin. The first step in caring for lacerations is to ensure that you give the individual some sort of clean towel or gauze to hold pressure on the injury site so that they can help start control the bleeding that's occurring. After you have put on your appropriate protective equipment, i.e. your latex gloves, you can remove the towel and assess the severity of the laceration. As a general rule, any facial lacerations require a referral to a physician for possible suturing to limit the extent and visibility of facial scarring. The sooner the referral, the better. But the physician should be seeing our patients within 24 hours after their injury. The bleeding should be controlled and the laceration should be dressed with a sterile bandage. If the bleeding is controlled and properly dressed, the athlete may allow to return to play as long as they have no other underlying injury such as a concussion or a fracture. If there's an avulsed tooth, or if there's avulsed tissue such as the lip or on the ear, make sure that the avulsed tissue is cleaned and placed or wrapped in sterile gauze and placed in sterile water. And then we are going to place that on ice and then transport it with the athlete to a medical facility for possible reattachment. In my years as an athletic trainer, there are some injuries that may not require stitches but are difficult to stop bleeding. In this scenario, utilize medical adhesives known as steri-strips to close the laceration and then properly dress that laceration as stated previously. Foreign bodies in the eye can occur with sports. This includes getting a finger poke in the eye by a teammate or an opposing player, or getting some sort of dirt or debris that may be lodged in the eye. Almost always with a foreign body in the eye, there is some degree of corneal abrasion that occurs. This causes extreme irritation to the eye, resulting in redness, itchiness, and discomfort when blinking or moving the eye. Foreign bodies in the eye should not be removed until the individual has been referred to a medical facility that can remove it without causing further damage to the cornea. After the removal of the foreign body by a medical professional, the eye is stained with fluorescent dye that basically gets stuck in that abrasion and is seen by a special fluorescent light to determine the extent of that abrasion. The patient with this injury may be able to continue life as normal, but due to risk of infection, they may be prescribed special medicated eye drops or instructed to wear an eye patch. There can also be a degree of light sensitivity associated with this injury. In the case of increased light sensitivity, an individual should be encouraged to wear sunglasses, even indoors, to help better protect their eye and aid its healing. A hyphema is a symptom of trauma to the eye. It is a collection of blood within the anterior chamber of the eye between the iris and the cornea. Initially, there is just some red in the anterior chamber, but within 2 hours after injury, the blood in the anterior chamber settles on the inferior portion of the eye, or it may fill the entirety of the eye. This can cause the patient's vision to be partially or even completely blocked. A hyphema is a major eye injury that can lead to serious issues with the lens and retina and may even lead to blindness if left untreated. As it is a major injury, immediate referral to a physician should take place. The patient should be transported to the hospital in an upright position until they're able to be examined by that medical professional. Retinal detachment is another serious eye injury that, in sports, can occur from a blunt force to the eye. Although this injury is painless, the patient usually begins to see floating specks in their eye, followed by flashes of light, blurred vision, and then as it continues to progress, the patient will describe a curtain falling over their field of vision until they become completely blinded in that eye. These individuals should be given eye patches that keep both of their eyes closed until they reach a medical professional that you have referred them to. If there is complete detachment of the retina, surgery is required to correct the issue and restore vision to the eye. If surgery is not required, they will need to remain on bed rest with both eyes closed for a prescribed amount of time. Dental injuries can come in several forms, but are typically the result of being hit in the mouth by some sort of blunt force trauma. Tooth fractures are when the tooth is chipped, or you probably have heard it as a tooth being chipped. It can be a minor fracture that only causes part of the distal tooth to fracture that is associated with some pain some of the time. Or it can be a major fracture that occurs more proximal on the tooth and exposes the nerve underneath the tooth enamel. That is going to create an extreme amount of pain for the patient. Those that sustain a tooth fracture should be instructed to gently bite down on a towel or a piece of gauze that's been wetted with some lukewarm or room temperature water or saline solution. This is especially so if their nerve root is exposed. Fragmented teeth can usually not be reattached, so a dentist will need to reconstruct a prosthetic tooth to cap that fractured tooth. Tooth subluxations, which is pictured on the upper right of this slide, involve the tooth being slightly moved out of place and then returning to its original position. They're typically pretty painful, very painful, and often bleeding occurs at the site of the gums. For tooth subluxations, the individual should be instructed to again bite down on that clean towel or a piece of gauze gently and then be referred to a dental specialist to ensure the tooth will heal correctly. Tooth luxations, which is pictured on the bottom left, are where the tooth is essentially displaced within the gums. It is basically what you experienced when you were losing your baby teeth and you had a loose tooth, but it's caused by a direct blow to the adult set of teeth. Again, there will be some associated bleeding involved with this injury, and the patient should do their best to keep their mouth closed or gently bite down on a clean towel or piece of gauze until they can follow up with a dental specialist. Lastly are tooth avulsions. This is getting your tooth knocked out. These injuries also are associated with extensive bleeding from the gums and quite a lot of pain. Caring for this injury involves placing gauze on the site where the tooth has been avulsed from, or if the tooth can be recovered, the tooth should be cleaned, and I know it sounds really gross, but the tooth should be attempted to be placed back into the gum where it fell out of the mouth. If that is impossible, then the tooth should be placed either in a tooth saver kit or it should be placed in a cup of milk to help preserve it. The tooth and the patient should then be immediately referred to an orthodontic specialist, and the tooth should be attempted to be replaced. Okay, so first of all, I just want to make sure that you all know that if you ever hear the word epistaxis, that is the medical term we use for nosebleed. So nasal fractures is associated with pretty instantaneous epistaxis or nosebleed. It's caused by a blunt force either directly to the nose or across the nose, causing it to become displaced. The individual will have pain, as well as inflammation and an inability to breathe through at least one side of their nose, or at least one nostril. They may also have visual issues like excessive tear production, blurred vision, or double vision. These patients should get an ice pack to hold gently on their nose that has been plugged with nasal plugs. They should remain with their head forward and should not attempt to tilt their head back to try to control the bleeding. They should be referred for x-rays and follow-up care by a physician. Cauliflower ear is either an acute blow to the outer ear or repetitive trauma to the ear. It causes bleeding to occur within the layers of tissue in the ear that causes a burning tender pain in the outer ear. These injuries can go away on their own with the use of protective headgear, cryotherapy, and NSAIDs, but a physician or trained professional may also have to aspirate the fluid from the ear to relieve the pressure and reduce the pain. If left untreated, the hematoma solidifies and excess cartilage is laid down, resulting in permanent deformity of the outer ear. A ruptured eardrum can occur either from a foreign object entering the ear canal or from a very hard blow to the outer ear. These individuals complain of a loud pop in their ear immediately followed by the onset of pain in their ear. There can also be nausea, vomiting, and dizziness associated with this injury. They will demonstrate hearing loss in the affected ear, and upon physician examination, a visible wound in the eardrum can be seen. Most small to moderate perforations will heal on their own within 1 to 2 weeks, but if infection can occur, so the ear should remain protected and cleaned regularly. Patients with a ruptured eardrum should also not participate in swimming activities or fly, as this may exacerbate the injury or lead to infection. Trauma can be somewhat mild, the case of a blunt trauma that causes a contusion to the neck or throat without any other associated issues with breathing. Or it can be extremely life-threatening and severe in the case of a laceration or a blunt trauma that causes the hyoid bone to fracture. Lacerations to the neck need to immediately be cared for and referred to a physician via EMS, especially if the bleeding is severe. Hyoid fractures can result in a compromised airway and again create a life-threatening situation that needs immediate referral via EMS to the emergency department or for proper treatment. If an artery is lacerated, the artery needs to be plugged. And this sounds pretty grotesque, but the best plug is a human finger. Glove up and save that athlete's life. Keep your finger in the lacerated artery until you reach the hospital, and then take care of yourself mentally afterward. This is going to be kind of blunt, but your mental health needs to come secondary to the life of the athlete in your care, and you need to do what is necessary to save their life. Swimmer's ear is a bacterial infection that is often seen with water sports. It can also be fungal infection, but most often it's a bacterial infection. It occurs when water is trapped in the external ear canal and results in an itching, pustulous discharge and pain in the ear that is worsened with palpation. There may also be associated hearing loss with more advanced cases of otitis externa. Refer these patients to a physician to be prescribed with an antibiotic ear drop. Ensure that the patient keeps their ears clean and dry and monitor them daily, as this may lead to infection of the inner ear or possibly deterioration and rupture of the eardrum. Otitis media is an ear infection. They are caused by a virus, in which case they need to just be given time to heal, or they may be bacterial or fungal, which can be treated by an antibiotic or antifungal ear drop. These individuals typically have some associated hearing loss in their affected ear, as well as itching or burning sensations and or ringing in their ears. However, there is generally not a lot of pain associated with this medical condition, just a great deal of discomfort. Refer these patients to a physician for removal of any excess earwax and a cleaning of their ears. And then, if bacterial or fungal, the physician will prescribe antibiotic or antifungal ear drops. Ensure that you follow up with these individuals to make sure that they are keeping their ears clean and dry, especially if they are a swimming athlete. They should sanitize their ears both before and after activity and make sure that they are wearing earplugs during their swimming activity. Meningitis is either bacterial or viral, and it is severely contagious. Thankfully, most college athletes and college students in general are vaccinated against meningitis before they're allowed to participate in any college-sponsored events or be a part of the college campus. That being said, it is extremely important that you're able to recognize the signs and symptoms that are listed here to recognize and appropriately refer these individuals for care by a physician. Meningitis is a very deadly medical condition, so it's very important that we get these patients the care they need immediately so that they're avoiding death. We have all had the cold or the flu before, but with how close our athletes are with one another and with the amount of contact that they have with their opponents from other areas, they are at a much higher risk for contracting and spreading the cold or the flu virus. Be aware of the signs and symptoms of each, the flu and the cold, to ensure that those infected are getting proper rest and are maintaining hydration levels and are keeping their caloric intake at high enough levels to continue to support their athletic efforts. Mono is extremely common among college-age athletes. It is of note to us because one of the symptoms associated with mono is enlargement of the spleen. With an enlarged spleen, the infected individual is at a much higher risk for a splenic rupture upon impact to their upper left quadrant. Due to this high risk, athletes diagnosed with mono need to be removed from athletic competition for at least 3 weeks until their symptoms subside and their spleen returns to normal. Sudden death syndrome in athletes is the most common cause of exercise-induced sudden death in athletes below the age of 35. There are 3 prevalent causes that lead to sudden death syndrome. The first is hypertrophic cardiomyopathy. This is a condition in which there is a thickened cardiac muscle with no evidence of chamber enlargement and extensive myocardial scarring. The second is anomalous origin of the coronary artery. This is where one of the two coronary vessels originates in a different site from normal. This compromises or obstructs that artery because of its unusual pathway in and around the heart. Third is Marfan syndrome. This is an abnormality of the connective tissues of the body. This abnormality of connective tissue results in the weakening of the aorta and cardiac valves, which can lead to a rupture of either a valve or of the aorta itself. Some of the symptoms leading up to sudden death syndrome include chest pain or extreme discomfort in the chest during exercise, heart palpitations or flutters, fainting, nausea, profuse sweating, heart murmurs, shortness of breath, fever, or feeling abnormally weak or tired. The best way to prevent this from occurring is to identify any underlying causes of sudden death syndrome through a pre-screening and appropriate health history of the athlete. If an athlete does collapse, we need to activate EMS immediately and begin with life-saving measures to save their life. Another cause of sudden death in athletes is commotio cordis. This is extremely rare, but it's caused by an impact to the chest over the heart during a very crucial time during the heart's beat. This causes the heart to essentially become paralyzed and causes the individual to have immediate heart failure. There are no warning signs leading up to commotio cordis, which again is why it is so important that we are paying attention to practices and competitions, because if we see an athlete experience a blow to the chest followed by their collapse, we need to immediately activate our emergency action plan to get the EMS on site and begin life-saving measures of CPR and the use of an AED to get their heart started and beating on its own again. There are several types of hernias that exist, but with sports medicine, the most common type of hernia is the inguinal hernia. This is also followed closely by that femoral hernia. An inguinal hernia, also referred to as a sports hernia, is usually caused by a tear in the muscles in the lower abdomen or groin that causes chronic pain. If left untreated, the tear in the abdominal wall continues to increase in size, which allows the intestines to poke through. This is a serious injury that can result in the rupture of the intestine and lead to a systemic infection and death. There is usually a palpable area of tenderness in the inguinal line, and if progressed far enough, we can actually palpate a mass that at that tender point, which is us actually palpating that intestine. The athlete must be removed from all athletic activity and referred to a physician. They may be able to conservatively treat this injury with rest, but some may be advanced enough to require surgery. This involves the relocation of any organs that have slipped through the abdominal wall and the subsequent repair of that abdominal wall with internal sutures. These athletes typically do very well after going through an extended recovery period, but special attention must be given to strengthen their abdomen to prevent re-injury from occurring. So we've probably all either had pink eye or know somebody who has had pink eye. It is a pretty common medical condition within athletics, as the cause of conjunctivitis is bacterial, viral, fungal, or allergen related. All things that athletes are exposed to, especially if they get someone's finger or dirt in their eye while playing in their sport. It causes the eyelid to swell and can have a yellowish pus that accumulates on that eye. It causes itching and burning sensations in the eye as well. If viral, bacterial, or fungal, it is extremely contagious. These individuals should be referred to a physician for treatment with antibiotic eye drops if it is a bacteria related or fungal related reason for the conjunctivitis. If it's viral, however, it just has to run its course. These athletes should not be allowed to participate in athletic activity that has any sort of contact involved. If they are in a sport like track or cross country, where they have no contact with other teammates or opponents, they may be allowed to participate as long as they continue to practice proper hygiene and continue to prevent the infection spreading to others.